Hello, my name is Leigh Ann Scott, and I just want to tell you a little bit about myself. I was born and raised in West Texas, which I love, by the way. I graduated from Monahans High School, then attended Texas A&M University, where I got my undergraduate degree. Then I went to medical school in Galveston at the University of Texas Medical Branch there. I later came to Dallas to do my residency, became board certified in obstetrics and gynecology. It was during my residency that I met and married my husband, Ed Clifford. After being married a few years, we decided that we wanted to start our family. And at that point, we realized we had some infertility issues that we were able to work through. And we are very blessed to have a daughter, Maggie, and a son, James. With the birth of James, we realized that the challenges of after our call and responsibility were extremely difficult. And at that point, I decided that I would step back from my practice and just focus on my family responsibilities, which is what I did. Fast forward about 10 years, I had some gynecological problems myself and ended up having a hysterectomy and had both ovaries removed. And even as a gynecologist, there's some apprehension about having a hysterectomy. However, I became acutely aware of the difference that hormone therapy could make. And after I got my hormones optimized, I felt great and realized that that was an experience that I could share with friends and patients and family, that this did not have to be a bad experience. As a matter of fact, I always conclude by saying I celebrate 4 days: my anniversary, the birth of my 2 children, and the date of my hysterectomy, because I feel so much better now than I did. And I do feel like that's helpful in talking with patients, because I feel like knowledge is power. And I try to share my story with them and encourage them to read about hormone therapy and do all this prior to their hysterectomy if they can. And if they've already had a surgery, then go ahead now. It's never too late to become informed about that. And I think it can take that experience and remove some of the anxiety surrounding a hysterectomy. 5 years ago, I was fortunate to be able to go to work for a healthcare provider that focused on bioidentical hormone therapy. During that time when that was going on, I kept running into people, former patients, friends, and people were constantly saying, "I'm just sick and tired of feeling sick and tired." And I just realized that I was very convicted that my passion was to go back and open my practice and try to help both men and women come up with an individualized approach to achieving their optimal health and wellness. And we do that by extensive lab work, looking not only at hormones, but just other wellness markers. And then we sit down and go through the lab work, and based on individual needs, because every patient's unique, we try to develop a specific healthcare plan for that patient, including exercise, nutrition, supplements if that's indicated, additional testing for food sensitivities if that's an issue. Sometimes there are some GI issues. We can focus on intestinal permeability, leaky gut. Some people have nutritional deficiencies that we can evaluate and treat. We can look at adrenal fatigue. There are neurologistic tests for brain wellness markers and things like that. Just whatever the individual needs are, we try to come up with a specific plan. I'm affiliated with Renewed Vitality. We share the same philosophy. We want everyone to be the best they can be at whatever age they are. We use a holistic approach to try to get to the root cause of the problem, with our goal being that we want people to just get their lives back and have renewed vitality.